12:37 is your time. We've got Dr. Jason Rogers joining us with the Center for Sports Medicine and Orthopaedics. And I always have to brag about you guys because you guys did wonders to my knee. I've got 3 pins in my left knee, and you guys have a wonderful team of doctors. It was so funny during the commercial break. I just happened to ask him. This is the first time I've met him. I said, "How long have you been in Chattanooga?" And he goes, "1 day." Welcome to Chattanooga.
Thank you. Thank you. It's nice to be here.
Brand spanking new. Brand spanking new. Well, all right. So, Dr. Rogers, tell me about this anterior hip replacement that only a handful of doctors in our region do this.
Right. So anterior hip replacement is one of 3 different approaches that's used for a total hip replacement. You can go from the front, you can go from the side, or from the back, and the anterior hip is one of the things that I trained in my fellowship.
Yeah. We've got a couple of slides here we want to show everybody, and obviously you're going to have to explain what this is all about.
Right. So this just shows the 3 different approaches. You can either come from the front, the side, or the back, and each approach has its pros and cons.
And this is the side that we were looking at.
Right. That's exactly right. Yes. And this just shows that it's a muscle splitting approach as opposed to a muscle cutting approach. The nice thing is once you dissect down onto the hip by splitting, that's all you have to do. You don't have to cut any muscles to get there.
So with people having IT band issues maybe after surgery, is that an issue because you don't go through that way, right?
That's a theoretical advantage, but in my practice, I have not seen that. IT band is about the same between all the approaches from what I can tell.
Yeah. So when you talk to a patient, and do everybody that needs a hip replacement, do they qualify for this particular hip replacement procedure?
This particular procedure is slightly more technically challenging than some of the other procedures. I try to reserve this for certain patients in my patient base. So I talk with them about the pros and cons to this approach and all the other approaches, and then we come up with a decision together as to what's best for each patient.
Okay. So give me an example of somebody that would qualify for this particular procedure.
Sure. Because it's a muscle splitting approach, the smaller the muscles are, the easier it is to get down to the hip. So usually the elderly females are the ones that are the easiest to perform this procedure on. The large muscular males, the big weight lifters, the guys that are very athletic and young, those are the ones that are a little bit more difficult.
Okay. And for those, I guess, younger athletic types, you would use the traditional approach?
I would usually resort to a more traditional approach. Yes, that's correct.
So you mentioned the pros and cons. What are some pros and cons with this procedure?
So the pros of this particular procedure is the fact that you actually can take an intraoperative x-ray and make sure that the leg lengths are about even, leg length and offsets about even, so you can match the anatomy a little bit more accurately. With regards to the cons, it takes a little bit longer, and there's slightly more blood loss associated with it. So again, these are things I talk with my patients about before we undergo any of these procedures.
Is it less invasive than the traditional hip surgery?
It's a slightly smaller incision. Minimally invasive is, some people say that it's a minimally invasive approach, but the way I usually tell my patients is it's a hip surgery. It's going to be as large as it needs to be in order to perform the procedure correctly and accurately.
Sure. What's the downtime like after this particular surgery?
I've had patients in 6 weeks that are up, moving around, and they want to get back to their normal states of health and states of function, but usually at that point in time I give them the red light and say, hold on, we need to give it a little bit more time to let that incision heal and let the hematoma dissolve.
Dr. Rogers, thank you very much. Welcome to Chattanooga, and it's a pleasure getting to know you the last few minutes. For more information, Center for Sports Medicine and Orthopaedics for a location near you. Call this number 423-624-2606, sportmed.com. Coming up